$240 million was made available to schools across Michigan through the State School Aid Act. And the American Rescue Plan Act included more than $170 billion for schools across the country. Many schools are using the money to invest in the programs to support the health and well-being of their students. In tonight's Crisis in the Classroom, Up North Live's Josh Kerman looks at what schools are doing and how 2 years of the pandemic made mental health a top priority.
Julie Sisson has been a guidance counselor at Boyne City for 4 years. She says more and more students are looking for help.
There is, especially in northern Michigan, the access to mental health services is not as available as it is if we were in a greater metro area. And so I think a lot of times we're kind of within schools, we're kind of the first identifier for families and students.
Sisson says the pandemic brought the need for more mental health support to light.
I would say in a weird way, I don't know if I want to say it's a benefit from the pandemic, but I think it's raised greater awareness of the need to support individuals with their mental health. And I think it's become more comfortable to be able to talk about.
In Alanson, the district is investing in training for teachers and support staff.
So we saw that need before the pandemic of our kids struggling socially and emotionally. And so we invested in a program that would be consistent and something that's very easy for our teachers to implement without taking time away from their core academic needs too.
And Superintendent Cook says Alanson is trying to grow its support programs as quickly as it can.
We have a social emotional curriculum called Move This World. And right now it is for kindergarten through 7th grade. Here we will add 8th grade, and each year we will continue to add another grade level.
Cook also says they're hiring more support staff to help with these programs, something that wouldn't be possible without the new funding.
So the ESSER funds that we have received is what is allowing us to hire our behavior specialist for next year, which will add to our counselor and our social worker and the curriculum that we already have in place. So without that funding, we would not be able to hire a behavior specialist.
Cook and Sisson both explained the need for these programs continues to grow as students, parents, and staff get more comfortable facing mental health issues head on.
Almost normalizing the ability to be able to ask for help is vital, and especially when you think of elementary and middle school and high school, this is a time where we really want to equip kids with that ability to ask for help and know that help is available for them.
Josh Kerman, Up North Live News.